that this will serve as a basis for the speaker to come. So I'm setting the stage and the big picture, hopefully, for these are my disclosures. So, because our view on the central nervous system has changed, that's the one. The nervous system itself has not changed, but our view on it has changed. I will talk about networks because I like networks, and then central vestibular system as a network. This is our traditional view of the brain. We separate it in parts, but they are one unit still. We think about lobes with specialized sets of functions and sharp dividing lines like fissura sylvi, and we think about the functions that the lobes have, and very often separate a spinal cord also as a different thing. But as you will envisage, it's essentially the same structure, the central nervous system. We very often talk about localization in neurology, certain places of the brain taking care of certain functions. And this is the traditional view of the cortex. The first information that we really got about localization was language disorders. As you may remember, Paul Broca and Karl Wernicke, and those areas. But still, we understand that these need to be connected, and there is even an anatomical structure connecting them. So this already hints to connectiveness, connectivity, which is the essence of having a network. The first ideas of localization were pure speculation, like phrenology. But then these certain patients, note that they are patients that teach us. That's the case still today. We learn from our patients. And then Corbinian Brodmann elaborated this, it's not visible. So he divided cortex into 52 different regions, sharply divided by histology and so forth. It's still a very useful map of the brain. But still, we may refer to Brodmann areas of cortex. And you may elaborate with modern techniques and parcellate cortex up to 180 clear-cut areas. But this is still localization. We know that they are connected. They are connected by white matter tracts of the brain. We know about the anatomical structures that provide connectivity. And also because we need to think about function at the same time. We have separated or lumped together as functional units, like fronto-subcortical areas. They are clearly one unit, and basal ganglia. But still, this thinking tends to be quite static. We kind of freeze the scene. We take one fragment. It's fragmentary and reductionist. So we may miss the big picture, the dynamic element of it. Although we have the word network here. Still, in everyday life, we are parts of networks, cosmic networks, social networks, what have you. And at the end, we are tied with the most complicated network, that's the brain. Now let's briefly digress into graph theory. It's one of the flourishing fields of mathematics. Network is a way of looking at a system that's composed of subparts. Subparts are nodes, and the parts that unite them are edges. Edges are kind of interactions between these nodes and subparts. some of them are connected with a large number of interactions, and they would be called hubs, and they would be very important to this system. So this gives meaning to the morphology that we talked about. We may think about the nodes and hubs as very much cortical things, and the white matter bundles that are connecting them would be the edges. They constitute the edges. Like in this picture, we see the bridges of Königsberg, the original when graph theory was kind of devised. Can you cross all the bridges by going one place to another? No, it was not possible. That was the graph theoretical problem number one. Or the airports of the United States. You may see super hubs like New York with very, very many interactions or edges. Now, we need not go very much into detail into this, but we may think about the brain as fairly scale-free. You have hubs that have very, very many connections, and also some hubs that have few connections, kind of lonely hubs. And this small world means that there is quite a short distance by average from one hub to another. So that means in practice that brain can be very densely packed. It's very economical. So as a scheme, we may look at the brain as consisting of modules like this. And every module is a network, and then sub-modules are networks and so forth. It's like a Russian doll. You take one, there's a next one, next one. And at the very bottom, there is neurovascular unit. So this is back to flesh and blood. You have the blood vessel, the synapse between them, and a perivascular cell, and the entity that is producing the fuel to the system. So you have these nodes that are maybe subserving one function, and then you have they are united as rich clubs with specialized functions. Then you have long connections that may subserve functions such as cognition, perception, cognitive functions, kind of global integration of local integrators. So in short, the properties of the neural networks of the brain. Actually, I realized that this is not the last version of this presentation. I have just a small break. Sorry about this. You may take a deep breath now. It seems that we have to do with this version, sorry. Yeah, no worries. Bildspel. So in short, networks of the brain. Cost-effective, small world neural networks, very effective long-distance connections, and a high degree of self-organization. That means that the input that comes to a module may give rise to features that have not existed before. That's emergence. And we have networks at all levels, gene-protein networks, synaptic networks, neuronal networks, and whole brain networks. This would be a reconstruction of structural brain, and nowadays it's possible to kind of make a map of the connections. The huge balls would be the big hubs, super hubs, and so forth. And this relationship between structure and function is not trivial. It's not the same thing, but there is a high correspondence. If you have a resting brain, we are contemplating, the activation very much becomes symmetrical in certain areas of the brain. So the structure and function, they are fairly constant in many ways. So these would be the many of the networks that we know, but they are dynamic and they are evolutionary. Attentive networks, auditory, visual. Default mode is the resting state network closely. But there's nothing about balance here, actually. Why should we think about networks? I think it's because we need to understand the connectivity of the brain, the dynamic whole, and how function arises from this hierarchy, the emergent properties. And it's always a question of certain degree of modeling, so that this effective connectivity that has a direction, we get it only by calculation and modeling. By imaging and so forth, we may get structural information and functional information. We could say that we have entered the era of network brain. And it's a huge amount of information. But now we have this artificial intelligence, and we are able to handle this incredible amount of data. This network brain idea would not have been possible before. And brain certainly is the most challenging object for this artificial intelligence. The concept of connectome is the big idea of trying to create the wiring diagram of the brain. Okay, let's move over to the central vestibular system. Now we are bypassing for a while the peripheral end organ. That we all know that there's something in the inner ear that keeps us erect and so forth. If we think about the eighth cranial nerve at the vestibular part, about 2/3 of it go directly to posterior fossa, and this is the nucleovestibular complex, which is the main integrator. This would be the heart of the system. There are 4 main nuclei and several subgroups. They are strictly ipsilateral, but they have very strong interconnections. 1/3 is going to cerebellum, and so that already kind of underlines the significance of cerebellum and how they have evolved together. And they come back from cerebellum to nucleovestibular complex. This is a close-up of those nuclei and where they are here in the ponta medullary junction. This NPH is not normal pressure hydrocephalus, it's nuclear prepositus hypoglossi, not directly giving, the vestibular nerve does not directly go to that, but it has a very strong connection with the system, and it's has to do with the stability of gaze and kind of a place velocity integrator. DVN, dorsal nucleus, lateral nucleus, medial nucleus, and superior nucleus. This is the one that we know, the fantastic thing as such, but it's a bit, an analogy would be if we think about reading, and we would be just concerned with the eye. Eye is fantastic and absolutely essential so that we can read, but everything that pertains to reading comes, and what is interesting is after the peripheral end organ. And I think it's the same thing with the vestibular system. But this has been overlooked very much, and I think it's kind of between the disciplines. Otologist thinks that it's central, not for me. Neurologist perhaps wants to think that it's vestibular, and a neurosurgeon is already exiting the picture. A simplified look at what happens in the input to this vestibular nuclear complex. Already at this stage, I would very much pay attention to neck proprioception. Very important information that you need for balance. Information of the body limb positions and position of your head specifically. Reticular formation with eyes, prepositus hypoglossa, we talked about that, interstitial nucleus of Cajal with stability of gaze in vertical direction and integration also of the body input and so forth. Optic tract nucleus and accessory nucleus with the optokinetic nystagmus, how it comes about. And spinal cord information, absolutely vital. And cerebellum controlling and regulating timing, posture, proprioception, muscle tone. And then we need cortical input so that we may suppress the many reflexes that come naturally from there. Then the output. A similar type of projections, very kind of short latency pathways. And one of the major objects is to keep a gaze stabilized, vestibular ocular reflex, foveate, so that it's we may follow the object with our eyes. Another vestibular spinal reactions, so that we react. We will hear more about the vestibular spinal things a bit later on, so I will not dwell on that. And what is extremely important, that you have very many connections via thalamus to cognition, all the way to hippocampus. So it's place, coordination, navigation, and then autonomic nervous system. If you think about the patient that Björn Bragée is winching up in this, from supine position up, it makes heavy demands on the system. Circulation, lymph, flow of lymph even, and cardiovascular system. Strong reactions that are regulated by the autonomic nervous system. And it's a small wonder there are 3 pathways at least, and also connections to the limbic system. Very trivial example, when motion sickness, very strong autonomic symptoms very often. You're pale, it's anxious, so forth. Autonomic activation. And also connection with the endocrinological system. Locomotion is something that's very often envisaged as a simple thing. You have a cortex giving commands and what happens after. But actually it's also a network that has a very close connection with the vestibular central system. The most basal thing is on the spinal level. You have generators. You have hardwired things that are there at birth. When you put a baby in upright position and the feet touch the table, the baby starts locomotion, ambulation, despite the fact that the baby cannot by any means move in any way. The next level would be reticulospinal systems, very closely also functioning within the central vestibular system network. It can be activated by midbrain, alternatively from diencephalon. And then you have the highest level of motor cortex that is going through basal ganglia, mainly inhibitory action, refinement, selection of action, and so forth. And many other areas can also trigger this locomotion. Also the limbic system. All of a sudden you need see something beside you that looks like a snake. It's a very primitive reflex that you start up and fly away. And there is still neuromodulation as well involved to make it not too simple. You have dopamine, noradrenaline, serotonin, and excitatory amino acids. Many of these main regions, such as nucleus raphe, serotonergic input, they have direct connections to the central vestibular system. What may be most fascinating is the cognitive, vestibular cognition. So that here we have the vestibular nuclear complex, and several pathways, 4 or 5, very often going through thalamus and projecting to medial entorhinal cortex and all the way to hippocampus. So in hippocampus we have the place cells, grid cells, head direction cells, and there seems to be head direction cells all the way, all over the brain. So the head direction clearly is one of the most essential facets of the whole. And also hippocampus with this creating the cognitive maps. And it also has a dimension of time, projecting into the future and memory of our cognitive maps. And finally, the cortical projection areas. We often think that the main cortical area is this, the posterior part of the insular cortex and part of the parietal cortex. And it probably very much has to do with the body position, relating that to the vestibular information that we get from the inner ear. A bit further up, it's more integration. This area on the whole is multisensory integrative area. So it's in many ways interconnected. If you think network-wise, this would be a hub or super hub, certainly. Further away in this parietal anterior part, differentiating whether you move or the object is moving. And further back, object related to head movement. The medial temporal superior part, also self-motion, object motion information. Retrosplenial has to do with navigation, and then the projections to hippocampus with the head direction cells, grid cells, and this cognitive mapping of this area. So, it's small wonder that this system and this network of networks is responsive to very, very many types of stimuli. Gravitation, our main form of acceleration. And on the whole, it's interested in the change in velocity. the delta V. It's either deceleration or acceleration. And it also censors the obliqueness, whether you're going upwards, how the pressure on your soles of your feet is going. And also quite a trivial thing, when you jump into the water, the weight of your body becomes radically different, and it must sort of react to this situation. Riding in a car can be crucial for patients who have problems in this thing. Eye movements on the whole, oculomotor things, whether you have to move your eyes or follow with your eyes. And also, if you're looking at things that are too lively, that may be an input. If you can't filter according to the saliency, that maybe produce effects within this system. And note that not necessarily you move your position in any way. It's sufficient that the center of the gravity is moving, or you have the ground where you're standing is becoming. Otherwise, or if you are holding an object, like if you are watering flowers and you need to fill up the the container, right? So and you put it on the water tap. There's no movement, but the increasing weight will cause a need for the system to adjust, and that will come within this system. Vibration seems to be a very strong effect. So this is the afferentation, things coming to the central vestibular system. And the responses, differences muscle tone, balance, this kind of locomotion responses. So these may produce a variable spectrum of things. These would be the efferent problems in the efferentation, imbalance in the efferentation. Disturbances of embodiment, for instance, are quite, they may strike a physician as bizarre and not be recognized, when the patient is telling that in this position they feel that their hand is growing like this, or becoming a formless club or something like this. Last but not least, autonomic responses, very, very common. So the roles. I would say that this system is differentiating between frames of reference, and actually it's doing differential calculus. It's integrating and counting derivatives. If you think about a setting where you are on a moving train and you walk along the corridor, there are very many frames of reference. You look outside, you can see trees swaying in the wind. There is someone coming past towards you. And ordinarily we have no problems in differentiating who is moving and who is not. Perhaps the classical error is usually when you are on a stationary train and it very slowly starts moving. Then it's for a moment it's hard to detect who is moving. So overview, why all this connectivity and network of networks? The system needs to know position in space, the coordinates, especially position in your head. and how acceleration deceleration is affecting the peripheral end organ, and the joints of the body, how eyes are moving. Are they my eyes that are moving? Are there objects moving? So that it may correctly guide our position in space, adapt us to gravitation in circumstances that may differ, and then keep this foveation, keep our eyes directed so that we see what we want to see. So, what does this have to do with things like craniocervical joint? I was saying that this is a seamless entity, brain and spinal cord. But actually, if you think about the cover, there is a transition zone. And this it's the craniocervical joint. For many reasons, this is, as you already know, this has very great significance, especially because most of the movement happens in the cervical cord and the upper part of the cervical cord. Rotation, nodding movement, and this upper cervical flexion, extension. And this is, there are absolutely vital structures contained in this. It needs to be mobile and it needs to be stable. And the stability is very much produced by ligaments. There is our problem. This reticulospinal system is connected to our alpha motor neurons that are producing our movement, but also gamma motor neurons that are adjusting the tension of our muscles. And the muscles in the upper part of the craniocervical joints mostly fixed to C1 and C2. They are very densely innervated by gamma motor neuron spindles. So there's a lot of information coming from those structures. So we know the basic building blocks here, and the trouble that we are dealing with ligament-supported structures. Actually, I'd like to stop here now.